Hey, it's Dylan in for Wiregrass Daily News, and I got Mr. John and Lisa here. John from
Yes.
People Engaged in Recovery, and Miss Lisa from Rural Addiction Prevention.
That's
RAP.
it. Yes, rap.
Cool.
Yeah.
Nailed it.
Yes.
So tell us
Good
what you
job.
guys got going on. What are we bringing awareness to here today?
So we are here to discuss the Enduring Their Legacies 100-mile walk is their voice.
Uh-huh.
This is the Overdose Awareness Month across the world, and so we're here to talk about, getting people out here to support us, to walk with us, to do whatever, how they want to cheer us on for this event.
A 100-mile walk. Where's that starting at?
Dothan Pier over here
Okay.
in Dothan at 1930 Wise Drive. We're walking from there. This will be a 5-day event, and we're going to be walking all the way to the Montgomery State Capitol.
Wow. Okay. That's a good destination to end at.
Yes.
I like that.
Yeah.
And this is happening August 16th.
Yes, August 16th to the 20th.
Okay.
And there will be different organizations joining us for this across the state of Alabama.
Mhm.
We will have hydration stations every 3 miles, every 10 miles. We're going to have resource tents set up so people can get resource information. There will also be free Narcan and other things to help people just, fight this disease that's of addiction, but also fight this crisis that we're dealing with the fentanyl and stuff.
Right.
Mhm.
So give us a little
Yeah.
background on how you guys got involved with this and what it means to you and what you're looking to get out of it.
Well, a couple months ago, I got on Facebook and I made a comment about, I was trying to figure out what I could do for overdose awareness.
Uh-huh.
And I was trying to figure out something different. And I made a comment. I thought, I'm just going to walk from Dothan to Montgomery to the state capitol.
Yeah.
Well, next thing I know, some people chimed in, even from the state level, and said, sounds like a great idea, John. Why don't you get other people involved? I was like, oh, can't
you
back
gotta
out
do it.
now.
Yeah.
Can't back out now.
Yes.
But other organizations, I started reaching out, companies, organizations such as RAP,
Mhm.
also ACRM, which is Association of Christian Recovery Ministries. AARR is
Alabama Alliance of Recovery Residents.
Okay.
Ross, which is out of Montgomery North, from Montgomery North. They're the
Mhm.
same thing as the Peer, which Peer is we are a peer-driven company. Everybody that works in our organization is in recovery. We help with everything from treatment to detox. Even if they don't have insurance, we're still there to
Yes.
help. We're there for transportation to and from treatment. But
Okay.
it's just not about treatment. It's about what happens after treatment also.
Right.
We're there for them also to show them that, we're living a life different today than what we used to live.
Yeah.
And so that way they can see too, like, hey, I get it. Maybe I want this.
Yeah.
Because at the end of the day, this is about people who actually want it and not
Mhm.
need it.
That's right. Because, like I said, anybody can go to recovery and anybody can go to rehab and then leave rehab, and there's no accountability. No, they go right back to the same friend group, and
Yeah.
and it's just a cycle all over again.
Correct.
So
It
what you guys are
is.
doing kind of comes outside of all that as well.
Yeah.
It's
that's
part of
what's-
that, but is also outside of that.
Yeah, that's what's so great about the community centers. So once somebody leaves treatment, and then also what we're doing with the recovery cafes, it's a safe place for people to hang out, because a lot of times they do have that same family network or home that they're going to. And while, we can't, that's another thing we're working on is more housing. But in the meantime, we have these community centers so they can come in, they can hang out, they can spend time there. Around people who are not using anymore, get resources,
Right.
classes, groups, just so many different things so that you can, once you leave treatment, it's kind of hard. What if you have to go back to the same house or same friends,
Yeah.
and a lot of people do, and they're doing the same things. Then as much as you want to have that self-will not to use again, it's likely that you're going to wind up doing the same
Yeah.
thing.
You're in that environment,
Mhm.
so it's
Yeah,
natural just
might
to
as
fall
well.
back into
Mhm.
it. Yeah.
Because with people such as us that's in peer support, I mean, for some of us, we're available 24/7.
Mhm.
Mhm.
And because at the end of the day, some of us are waking up at 2 a.m. and if they're in recovery already, they want to use.
Yeah.
Mhm.
Or if they're in active addiction, they're calling at 2 a.m. and like, hey, man, I can't do this no more.
Mhm.
They're calling you
Yeah.
at 2 a.m.
I don't want to live no more.
Yeah.
What do I do? I had a kid the other night call, 2:30 in the morning. He's like, Miss John, I can't stop. What do I do? I said, well, first off, you got to figure out if this is what you really want.
Mhm.
Do you want a different way to live today? If you choose it, I said, I will get up out of this bed right now and help you find a detox if that's what you're looking for. And he finally, we talked for about an hour and a half. And,
Wow.
and I carried him to a detox center. He is now in detox, and he's going to be there for a few days. And then we'll work on the next step of for his treatment for him, to
Mhm.
find him a treatment center. He did not have insurance. That's not an obstacle for us
Yeah.
because we have treatment centers that are state certified, state funded to the state of Alabama.
Yes.
That they don't have to have the money to move in or to go there for 28 days.
Wow.
They can
Mhm.
pay it afterwards. But now we do associate with organizations such as Bradford, which is out of Warrior. We also
Mhm.
deal with Recover Now out of McCalla, Alabama. And then we have
Mhm.
some across the state lines that we actually we can't transport them across state lines, but we can help them get down that way.
Mhm.
Find transportation or something for them, such as Banyan, Florida Springs Wellness, those other treatment centers. That we deal with 12 Oaks that
Mhm.
are down there crossing the Florida state line. Because the issue being right now is we have a 6-month waiting list for treatment, state funded,
Yes.
Wow.
and at the end you're sitting there, you're trying to figure out, okay, so 6 months. Well, that person's calling they want treatment. I might not find them in 2 weeks.
Right. They might not want
Right.
it in 6 months.
Yeah,
No,
Yeah.
yeah, they're
Things
not.
change.
but
Mhm.
they might not want it, or number two, they could be gone,
That's true.
or they could be
Yes.
incarcerated by then. Because um, at I just want to see people find a new way to live,
Mhm.
one day at a time.
Yeah.
I mean, I don't worry about tomorrow. I just worry about what now.
Yeah.
Now I'm worried about the 16th. Don't get me wrong. My wife has went up my life insurance policy to $1 million, and
Better eat your Wheaties.
Yeah.
I thought she's gonna kill me watching murder reality. Now she's done figure out a way to get away with this. So.
Yes.
But I mean, it's just about I want to bring the people together throughout the state of Alabama
Right.
to see from in all aspects of what we're doing together
Mhm.
that we have to do together. That it starts at the federal level, down to
Yes.
the state, down to the local government.
Mhm.
The mayor's office, the police department, the sheriff's department, the county commissioners. I mean, that we've had several of them people from especially local Commissioner Shoup, Lieutenant Hopkins Sheriff's Department. I work with Alan Hendrickson with the
Mhm.
Dothan City Police quite a bit
Mhm.
because what we're trying to also show everybody is don't be scared of them.
Right.
Yeah.
They're not going to hurt you. They're here to help you.
Mhm.
Because we have this thing in our heads, especially when we're in active addiction. Well, it's a cop. I don't
They
be
after
around.
me. They're
Yeah.
after me.
Exactly. They're looking for me.
Well,
Yeah.
I mean, I was probably breaking the law when I was thinking that, so
Yeah.
they might have been.
That's
But you know,
true.
like,
Yeah.
but yeah, they're there to be our friends. They're there to help us. They just want to see, like Jonathan said, they want to see you live a different life.
Mhm.
Help you get on a different path, and I think that's really important. For all of us to work together, band together to do that for people and be an option. And it's really important for peers to see Jonathan spend time with these people that they are scared of. Because if they're like, okay, well, if they're safe for him to talk to them, then it's
It's
safe
safe
for
for
me
me.
to talk to them. They're
Yeah.
they're not here to hurt me. They're not here to, take this away, and that they're part of this for us and just walking out there because they're going to be, walking with him. There's gonna be some paramedics and people like that. I think as he comes, I know as he comes into towns, they're going to be, holding up signs, just there to sort of, I guess, make sure everything's okay, as he's walking.
Mhm.
It's just a way to just really bring everybody together. And I just love that so much because that's so important for everybody to be on the same page, everybody working together, because everybody has kind of a different role. Like
Mhm.
we have different roles than clinicians, but there is nothing wrong with a clinician's role. A lot of our peers are like, we don't want to talk to them because they don't understand. Well, a lot of times they actually do understand. They just have a different role, so they might not talk about
Right.
how they understand in that way. So if we can work to bring these treatment centers that are doing these different levels of care, different assessments, and educate people on the process of it, because while in a perfect world we could put everybody in treatment right when they want it right that day, it's a process.
Mhm.
Even if it is free, there's still a process to it, and that's good for us because a lot of times in addiction we want instant gratification. We want what we want right now,
Right.
all the time, and that's what we're used to getting.
Yeah.
So it's kind of a good thing sometimes. Not saying that we want people to wait weeks or months for anything, but it is a little bit of a process. So educating people on the process, how it works, how we can all work together, and families on how to work with their family members. I have a family member right now who has decided to start using again, and our choice in that was to just completely cut the relationship off.
Mhm.
That's not always the right way, but I can't be for this person what I can be for a peer.
Right.
They're not going to listen to me in that
Mhm.
same way. Sometimes I can ask a peer, some of those hard questions, which is what we do a lot of times, like, what is it that you want? What is it that you need? Sometimes if I ask, if we were to ask family members that, there would be a lot of judgment.
Yeah.
I feel like there's judgment.
Mhm.
And maybe there is sometimes a little bit, because it's hard for us. We're like, we know what the opportunity you've been given, we know those kind of things. So we see that from a family's point of view as well, that it's hard.
Yeah.
So just educating, that's what, a lot of what Peer wants to do and does already do. There's actually a reentry coming up. There's just a lot of things at the Peer building that go on. So Jonathan's taken it outside of the Peer building, which he is always outside of the Peer building, but there's a lot going on inside the Peer building. So if anybody ever wants to check that out, there's always, different events going on. So,
Well, tell us a little bit about the Peer building right here in Dothan. What you guys do there?
So we had the Peer building here, People Engaged in Recovery. It's a community center open 365 days a year, open 7 days a week, 9 to 9, 9 a.m., 9 p.m. We are there as peer support for people who just want to come in and hang out. We have pool table, we have ping pong, we have board games, we got books if you want to read. We have big screen TVs if you want to catch a movie night with us. We have meetings 7 days a week. We also have, like she said, the 15th of this month, we have the On the Way Home organization out of Birmingham will be coming in to do a reentry workshop for everybody in the city, because we have some people who are coming out of the prison system, and the family members need to learn and figure out how to help these people to come out of prison. Because the ones I have transported out of the prison system, I've been in the prisons to talk with them and stuff, and I'm gonna tell you something. The scariest thing is when that door goes clank behind you.
Yeah.
yes.
In a big prison, not a jail, but a prison.
Right.
And I've been in there, and I've talked with them, with the men and women in there, and the scariest thing is what's going to happen to us once we get out. Because we got to remember, some of these people have been locked up so long they don't even know what a cell phone looks like.
Right.
Yeah, that's true.
They don't
That's
even know.
exactly right. You think about like
That's a
10
wild
years.
thing to think about.
Yeah, if somebody went into prison 10 years ago and they're coming out and they're literally let out the front door like, okay, see ya, bye.
It's a
kind of
whole
thing.
new world.
Could you imagine walking into our world now? Like that would be crazy. And then you think 20 years, that's just unreal. And so
Yeah.
I think that's really important to
I mean,
educate.
we've dealt with some people 30 years locked up. And I mean, that's
Right.
been
Wow.
since the 90s.
Right.
Yeah.
And I mean, and they're looking at us like, what's that?
Mm-hmm.
Yes.
I mean, they're getting into a car they've never seen before.
Yeah.
Mhm.
And then you see all them gadgets across the dash, and they're like, this is a spaceship.
Yes.
Because they haven't
Like
seen
walking
it.
out of a time capsule.
Right.
Really,
Right.
truly.
It is.
And so, and we're trying to help them to recustom to the outside world.
yeah.
Mhm.
And to teach them, because a lot of them, they get scared of this outside world,
Mhm.
and they become institutionalized, so they'd rather go back to prison
Right.
because that's where they feel safe at.
Right.
Yes.
They've got their
That's what they're
food,
used
they've
to.
got their
Yeah.
bed,
Yes.
they've got their drugs.
Mm-hmm.
Mm-hmm.
Yeah,
Because
because
they-
the drugs are in the
Yeah.
prisons too. Yeah.
Oh, yeah,
they
for
got
sure.
everything right there in the prison system.
Yeah.
And I
Yeah.
mean, and it's wild to me whenever they come out and they say, okay, we just put another 30, 40 beds for mental health, but it's going into the new prison. So I got to
Right.
go to prison and get mental health help?
Right. Yes.
I can't
That's
get it out
great.
here in the
That's-
street.
Yeah.
No. They
That's
can,
my problem.
yeah.
Yeah.
They continue to close our rural health clinics, and we've lost at least 50 mental health beds over the last year or two, and we didn't even have that many in the beginning. We're like number 51. Alabama's number 51 in mental health. I guess that's including Puerto Rico, is why I'm assuming 51. We were 48,
Mhm.
so we're at least up there in the list a little bit. But we're literally the last for mental health, and that's always something that goes along with substance use disorder, is trauma, mental health, all those kind of things, and that's what we want to help people with, because prison, prison is not where people need to learn how to. They're not going to be rehabilitated there.
Right.
They're going to learn how to be a better drug dealer, how to commit crimes better. We need to spend more money on treatment facilities, not bigger prisons. And that's something, that we can do, and that Jonathan's working on doing with this, is bringing more awareness for things like this. Because I know, your boss has talked about before, people coming out not knowing what a cell phone is. A lot of families don't understand or know that if they're supposed to be reporting to a day center, they're not allowed to get a job.
Mhm.
There's just a lot of stuff there that people don't always know and understand. And if we can start a rehabilitation process for people that could, go into these facilities instead of prisons, because they're overcrowded. It's just awful what's in there right now. It's not helping anybody's sanity.
Yeah.
It's just really sad, and so it would be great.
I think
to
we
do
mentioned
that.
earlier about a
Yeah.
documentary, Alabama Solutions. If
Yes.
you really want to get an idea of what the Alabama prison
Yes.
problem is.
Right.
Yeah.
Yeah. I mean,
It's huge. It's a
it's
huge
just
problem.
there's so many people in there that they're having to sleep on the floor. There's rats in the toilets. I mean, it's just no conditions for even a dog to live in.
Yeah. It is
And
not recovery. You're
no,
not recovering
no,
in there. It's not.
No reform.
Yeah.
no. And the SAP programs there's actually nobody running those SAP programs, or the people that are trying to are crying because they are recognizing that people want help, but they're not capable of doing it because they've never been trained, or they don't understand, or they need the
Yeah.
help themselves. And so it's a lot of good thoughts that they have going into it. And I get it. We understand consequences have to happen. But those are actually taking people backwards. You
Yeah,
know?
like we talked about earlier, going to rehab and then coming home to the same family members in the same
Right.
environment. You're in prison. You're literally in there with people that are in there for the same reasons and problems
Yes.
that you have, and you're just in that environment, and
Right.
they have the drugs.
Right.
Because my thing
Yes.
is, I try to teach my peers I work with. I teach them about recovery, but my thing is also putting them around different people
Mm-hmm.
than what they're used to hanging out with, and putting them around
Yes.
people who are actually, what we call responsible, productive members of society today.
Yeah.
Instead of, and because my thing is, I don't sit around and tell war stories.
Mm-hmm.
I don't romance my drug use
Right.
Yeah.
because that's my past.
Yeah. Why reminisce on it?
I'm thinking about
Yeah.
today and what's happening today. Now I would use, for an instance, say, okay, like 6 years ago, this is what happened. Okay, I had this thought one night I was wanting to use. Why did I want to use? Well, this happened. My child died. So what? But I sat down, and after this happened, I called my sponsor and stuff, and I said, okay, this is where I'm at right now. What do I need to do?
Mm-hmm.
And he said, okay, I want you to make a list out. Give me a gratitude list, number one. But on the other side of it, give me the consequences if you go use. What are you going to lose?
Yeah.
And
The pros and the
yeah.
cons of using right now.
And he said, but the thing about it, you're really not losing it. You're going to give it all away.
Yeah.
He said, the way you hit bottom is you quit digging. Simple and easy.
That's true.
I'm an old school recovery type of guy because I've been in and out these rooms since I was 17. I'm 51 years old now. My clean date's March 3rd, 2015. And for me, I don't believe in coddling.
Mm-hmm.
I'm willing to meet them where they're at, but I'm willing to also tell them the truth that they don't want to hear.
Mm-hmm.
And a lot of people call me because of that reason, and they call other people such as Lisa and a few others because we're the ones who's going to tell them the truth straight to their face. We're going to slap them with it.
Mm-hmm.
This is what's going to happen. Do you want to go sit in a prison cell for the rest of your life? Do you want to watch your mother and father bury you?
Mm-hmm.
Do you want to lose your child? Because I've worked with a young lady who just celebrated 1 year who got her children back, or her child back, excuse me, after going through DHR, anger management, parenting classes, going to 12-step meetings 3 to 4 days a week, getting a sponsor. She's now out here doing a poetry slam down here at the coffee shop. Something she never thought she'd do. She's got a job. She's got a home. She got her entire family back together. That's what our common goal should be,
That's
is to help these families get back together and build themselves as one.
That's
Because
right.
our thing is being of service to others.
Yeah, I mean, and even like you said, being like I started in the rooms at 19 and AA, and then have just tried and been in some different ones. But basically, the common thought there is you can't keep it unless you give it away. And so that's so big for us. And not to say that us as peer workers would want to use our job as our means of staying in recovery. We want to work a program or whatever that looks like. A sponsor, I have a sponsor and I call her. Getting a different perspective is huge because I know for me, I can get tunnel vision on something or just repetitively think about something. And she just gives me one little thought and I'm like, oh, I didn't think about that.
Breaks
Or
out of the cycle, yeah.
And she'll tell me something's normal. She's like, it might not be normal for people who are not used to using, but it's normal for you because you've used before. So it's just really nice to have that kind of stuff. But basically the theme behind all of that is to give it away what we've been given.
Yeah.
And that's what's so important.
And the cool thing about us as peer support, because there's some days we need to talk to each other, to bounce something off each other. And we can do that because we both know we're in recovery.
Right.
And we both know the way we're living today. Because I cannot call any Tom, Dick, or Harry out of the phone book and say, man, I want to go get high.
Right.
Huh?
Yeah.
What are you talking about?
Yeah.
I can't call just anybody and say, okay, this is what's going on with this peer. Can you give me a suggestion on how you would do it? On how you can help, how I can help this person? And like she said, because our job is 8 to 5.
Mm-hmm.
That's my job, 8 to 5, 40 hours a week. My job goes out further than that some days,
Mm-hmm.
but
Sure.
I'm running through a nonprofit, state-funded company, so I don't get overtime.
Yeah.
But so I put in a lot of hours off the clock, which does not bother me.
Mm-hmm.
But the thing what I'm trying to say is my recovery is 24/7.
Mm-hmm.
Yes.
I cannot. People have told me, "Well, I cut my phone off at 5 o'clock." Well, somebody wants to call you.
Mm-hmm.
Yeah.
Right.
Y'all want to call me 334-828-5987. Call me day or night. I don't care. I'm going to answer.
Yes.
Now you might not like what I have to say at first,
Right.
but after I wake up, we're going to talk about it.
That's right.
And we're going to find a solution and get out of the problem. Because
Mhm.
as an addict,
Yeah.
I stayed in the problem my entire life.
Right.
And it was always somebody else's problem.
Mm-hmm.
And it was all their fault, excuse me.
Yeah.
And I had to figure out, what's the solution to this?
Yeah.
What's the solution if, okay, this computer just crashed. What's the solution? Just redo it.
Mm-hmm.
Mm-hmm.
Don't be mad about it.
Yeah.
Don't be upset. But now
That
back
ain't
in
gonna
the
fix
day,
nothing.
yeah, but back in the day,
Right.
I would have threw the computer through the wall.
Right. Yeah.
I'd have jumped up and down on it, cussed, fussed, and everything else.
Yeah.
But now I'm just like, oh, well, I'm on the clock right now.
Yeah.
I'm cool with it.
Yeah.
Yeah.
I mean, I'm getting paid.
That's right.
Yes.
But people don't look at it like that.
Yeah.
Mm-hmm.
It's like, oh, man, we have murders happening often in Dothan,
Yeah.
Barber County, Pike County, Dale County, all these rural counties that we grow up in and live in. And I mean, and we all grew up together and we're shooting each other.
Mm-hmm.
Right.
It makes no sense. We're giving each other drugs that's going to kill another person.
Mm-hmm.
Yeah.
I tell my peers, you're buying dope every day that's laced with something else.
Yes.
Mhm.
Well, my drug dealer, he don't care about you because when you die, he's got 10 more behind
That's
you
right.
waiting with a pocket full of money too.
Right.
Or with a TV or whatever else you got
Yeah.
to give them.
Yeah.
Yeah. You're not the only customer.
Yeah.
No.
Yeah.
And
I mean, this
yeah.
is an enterprise for them.
Mm-hmm.
Mm-hmm.
Yeah.
Yeah, that's huge. And like you mentioned, when I first started working with Peer, because I used to work with them, the first year I was working with them, you know, we were seeing a lot of meth, marijuana, alcohol, things like that. And then it was like the second year, fentanyl was in everything, and it was 18 to 24-year-olds I was seeing. And they've got some serious laws now. If you're caught with fentanyl, like it's some serious charges.
Yeah.
So these are 20-year-olds that are never getting another chance, or I mean, they're just straight shipping them off to prison for so many years. And part of me understands that in a sense that there's consequences to this, that this is lethal. You know, but they need a chance to figure this out, because I know at 20 years old, I wasn't the smartest, you know, I wasn't making the wisest decisions. And I wasn't thinking through some of these processes, but it's just crazy. And then, like, you know, hearing people put stuff in these drugs. I mean, even in marijuana, people are like, well, I use the same, you know, marijuana dealer. Well, that doesn't matter, because where are they getting it from, for
Right.
one? And two, like, it's almost like a little bit of a power thing where people they like having that power of getting people. And plus, why wouldn't they want to put this other drug in there that you become so highly addictive, because you will keep coming back to them? And then it's a whole other thing, like with some of these younger people that I was doing these intakes on, and I would ask them, like, I mean, one had, you know, she had lost her child because her baby was less than a year old, and from fentanyl, the baby died.
Mm.
And so, you know, and she's back in jail, and she's got this situation going on, and I just asked her, like, you know, well, you're not worried about something happening to you? And she's like, well, I've learned how to use it now. That's something people say, I've learned how to use it. I know
That's
I can do
scary,
this
isn't
much. Very. Because if these pills are coming from China and they're pressed, well, China has no good intentions for us, first
Right.
of all. And then if it's pressed, you know, if it's this much on this point and it's this much more on this one, you know, who knows? But it's also like a little bit scary, because people like almost dying and being brought back to life. There's a whole addiction in that as well. And so it's just scary what's going
Yeah.
on with people in their minds, you know, and you know, how we can figure out how to, and that kind of goes along with the whole, you know, suicide and looking at that, and all of those are kind of together with the mental health of people, and what's happened to people since COVID, and the anxiety and the social media, and all those things are great, wonderful things, but we as Americans tend to overconsume until our deaths, really.
Yeah.
Because she's talking about China. I listened to a speaker at the Vital event in Prattville a couple months ago, and he was an author. I can't think of his name right this second. I apologize. But he was talking about the precursor the fentanyl precursor that's coming out of China. You can buy it for 125 American dollars per kilo.
Mm.
Wow. That's a lot for
Yeah.
$125.
Yeah. And the guy that owned the company, China refused to let him go for him to face charges in the United States. Well, he got a little stupid and decided to go on vacation outside China.
Mm.
And the DEA got him. And now China wants him back, and they're like, no.
Yeah.
Because they are shipping drugs into our country through the cartels and however other ways
Yes.
Mhm.
across the borders, and it's killing our communities. It's killing our citizens. And I am all for, if you're a drug dealer and you're out here selling fentanyl and you're going to get a life sentence, I'm all for it.
Yeah.
Mhm.
Because our children are dying,
Yeah.
have died. We are the voice right now for the ones that we've lost. That's what this walk is about. It's
Mhm.
about showing this entire state they're not forgotten.
Right.
Yeah.
We have a wall over at our community center that has over 140 pictures of people that have been lost to overdose.
Wow.
And that wall has grown so much in the last 3 years,
I can
Mhm.
imagine.
3.5
Yeah.
years.
Yeah.
And it started off with Nathan Money,
Mhm.
Cindy Money, who used to work for Peer. She still works in the recovery field, but it was her nephew that she lost. He took a Xanax that was not a Xanax.
Mhm.
And you can actually buy the pill press off of Amazon for $499.
Right.
Yeah.
And we've been at conferences where they put two pills side by side and said, okay, which one's a fentanyl?
Right.
And you look at them like, the
can't tell.
insignia is the
Mhm.
same, everything.
Yeah.
Now he knows because he can see the discoloration somewhat.
Yeah.
My eyes can't look at that and see it. But they know what they're looking for. We don't.
Yeah.
Yeah.
And so that's the reason I tell everybody, do not buy any drugs off the street.
Mhm.
Mm-hmm.
What started this whole crisis was what happened in the early 2000s with
Yeah.
the pharmaceutical companies, doctors, and everybody else. They were pushing Oxycontin, oxycodone, and whatever else. And then they took that away, so people went and got on heroin. And then
Mhm.
all of a sudden, here comes the synthetic fentanyl,
Mm-hmm.
Mhm.
the synthetic opioids. And it just ain't fentanyl. You've got Kratom, which is huge down here in
Right.
southeast Alabama.
Yeah.
Going right
Yes.
across the Florida state line. You're riding out there between Defuniak and Chipley, and you're in the middle of nowhere, but there's a store right there with a big old sign on
Yes.
says Kratom for
Yep.
sale. And there's nothing else
Just
within 10
bags
miles.
of it.
Yeah.
Right as you're checking out.
Yeah.
It's just
Yes.
bags of pills.
I
right
walk
Yeah.
into convenience stores and I see the pipes and everything else.
Mhm.
If I see that, I don't even give my business. I walk
Yeah.
out
Yeah.
Yeah.
because they're giving a drug. They're selling these drugs. When the Kratom first hit in Alabama, which Alabama made illegal, was one of the very first states to do it. But the convenience stores were giving it away for free so they could
Yeah.
sample it. And the
That's
next thing you
crazy.
know,
Yeah.
they're hooked.
Yeah.
Yep.
And a lot of people think that it's a supplement. Because I know
Yeah.
people that actively today use Kratom
Yeah.
and think that it's a supplement
Yeah.
Right.
and don't realize that it's like an opioid replacement
Yes. Yes.
and just as bad.
Yes.
Because it's a synthetic opioid is what it is.
Mm-hmm.
And we're being told the 7-OH and the Kratom, the withdrawals are 10 times worse than the fentanyl and heroin withdrawals.
Right.
Wow.
Yeah.
And so we literally have put him in a detox for 7 to 10 days, and it's a medical detox because you cannot detox yourself off an opioid. You will die.
That's crazy.
You can. The only thing I've seen worse than opioid withdrawal is an alcohol withdrawal.
Yes.
Yeah.
That's the only thing I've seen worse.
Yeah.
Mhm.
And I've been around 12-step programs forever. We've done 12-step calls back in the day where we'd pick up an alcoholic, we'd take him to treatment, and we hand him a bottle of liquor and say, drink on the way,
Yeah.
so they wouldn't have a seizure and die.
Right.
Yeah.
Yeah, that
for
makes sense.
sure.
Because the one thing I've enjoyed about working in this field is I've got to do research. I've got to learn.
Yeah.
Because she mentioned earlier, Alabama's so far behind on data.
Mhm.
So we're trying to make up for the past of what's happened there. Like our data for the OD2A is crazy that we have to do every month. We have to send it in, they okay it, they send it back, we send it back, you go back and forth for a few days. Because we're trying to get the correct data so that way the more funding comes in.
Right.
Because if we're not sitting over here talking about the deaths that are happening, the overdoses in our area, talking about its natural causes, 41 years old dying in the streets, it has not natural causes,
Mm-hmm.
Mhm.
especially if I know where he's been.
Yeah.
Right.
Me personally,
Right.
I know it's an overdose. Why give false numbers?
Yeah.
Give the correct numbers so we can bring the money
Get
into
the
this
help.
area
Right.
to fund this, to help this.
Yeah.
Because, it's been said, we have a high suicide rate in this city,
Mhm.
one of the highest in the state. Do you know that we have one of the highest overdose rates in the state of Alabama per 10,000 that visit the hospitals here? We are
Really?
number 1.
Wow.
Barber County is number 3. Henry County is number 5
Mhm.
Holy cow.
per hospital visits.
Wow.
Not saying they're dead, but that's the overdoses. We
Right.
have one of the highest. And this come from the ADMH and come from SAMHSA. This wasn't just made up out of our heads.
Right.
Yeah.
This is the numbers, because once you get to the hospital, they have to use the correct terminology.
Right. Yeah.
But it's not being released back into the community. The only time it's being taught back into the community is if it's a manslaughter charge for the dealing.
Mm-hmm.
Yeah.
Now, I will commend the City of Dothan Police Department and the Sheriff's Department. They are doing their darndest to fight this disease and to fight everything with addiction, but they can only do so much.
Yeah.
Mm-hmm.
I mean, we had to see our team was just hit Dothan with Alan Hendricks and them. That's a great program. It's helping people who are going through a crisis.
Mm-hmm.
You've got the drug task force that's been around forever. They're doing their darndest to get these drugs off the street.
Yeah.
But you can't get everybody off the street.
Yeah.
But the only issue that I have, and it ain't, and this is across the nation I've seen, we've been investigating them for 3 years. Well, how many people died in 3 years
Right.
before
Yeah.
you got to the
What are you
arrest?
waiting on? Yeah.
Well, we had to build a case. How many people have to die to get that case built?
Mm-hmm.
That's the only issue that I have.
Yeah.
Just needs to move a little quicker.
Correct.
Yeah.
Because, I mean, that woman I talked to yesterday that lost her son in Montgomery,
Mm-hmm.
she said, I don't know who sold my son to dope.
Yeah.
I just talked to a young lady that works over here for WTBY 95.5 who lost her brother 6 years ago.
Mm-hmm.
Mm-hmm.
People won't talk about it unless we talk about it. And then once we talk about it, like, hey, I know somebody that happened to.
Yeah.
Yeah.
Because it's no respecter of persons. I mean, addiction is across the board for anybody,
Yeah.
and everybody's family has dealt with it, themselves. And people think, like Jonathan mentioned, the cartel, like people think that, oh, that's not happening in Alabama. We're a perfect place
Oh my
because
gosh.
of where we are to be
They're
for
literally-
stuff to go through here.
Yeah. Absolutely. We're
Yes.
a hub.
Yes.
It seems like right.
Birmingham, all of that, it just goes straight up there to
Yeah.
Atlanta and these different areas.
But you
So-
got to remember, Dothan's right there in that tri-state.
right,
Mhm.
exactly.
And we're the way to beach to Florida,
Yes,
Yep.
exactly.
we're the way to Atlanta, we're the way to
Yes.
Birmingham, we're the way,
Yes.
you ain't got to go to Mobile this way if you don't want to, but you can choose that way if you
Right.
don't want to go out the
Mhm.
interstate. Because if you're trafficking dope, you're going to try to find a back road to go through.
Yeah. You
Yeah.
ain't
You're not
riding
trying- yeah.
I-10 all
Right.
the way.
Yeah.
Yeah.
You ain't trying to be out there where they see you.
Yeah. You're trying to be sneaky.
Right.
Yeah.
Of course.
So, I mean, but then you got all these rural counties where the meth is still being cooked.
Oh,
Yep.
yeah, for
You
sure.
know, the meth is still being distributed. You know, the marijuana plants are being grown.
Yes.
I mean,
yeah, they ain't doing that right downtown.
no.
no.
Well, now they are downtown
Well, they
Montgomery.
probably are, but
Montgomery they are now. They just opened the first marijuana
because
Yeah,
now
dispensary.
we've approved,
Yeah.
let marijuana
But I mean,
be a-
and the thing about it, and they tell me, well, they're not doing meth, they're just smoking pot. Now, I believe in complete abstinence.
yeah,
That's me.
too.
I don't believe in doing anything. But there are programs such as medical assisted treatment that are out there that help with the opioid withdrawals and stuff with such drugs as Suboxone and methadone.
Mhm.
I believe in using that and being able for a client or a peer to use that to be able to get through what they're going through.
Mhm.
Yeah.
Because at the end of the day, we're just trying to save their life. We're distributing Narcan we're the number 2 county in the state of Alabama that
Yeah.
put out most Narcan
Wow.
behind Jefferson County.
Mhm.
Dothan, Houston County is number 2.
Wow.
It's because of organizations such as Peer, other organizations across the city that have
Mhm.
put out the Narcan, the police department, the fire department, the mental health organizations that are here.
Mhm.
We've all done our part because you're enabling them. No, we're trying to save their life.
Yeah.
Right. Yeah, I wish that Alabama would be more into harm reduction
Mhm.
because it's a helpful thing. I mean, it's proven that it's worked, and we're just a little bit slower on getting on board with the harm reduction. We have with the Narcan, but there's some other things I don't know if they'll ever get on board with, and I can kind of see a point in it. But harm reduction it works.
Yeah, for sure.
Because right now we're doing the 1-box distributions also.
Mhm.
The 1 box is it's a box. It's actually like a first aid kit for overdose. You open it up, it's going to have 4 shots of Narcan. It's going to have the gloves in it. It's going to have the mask, but it's also got like a little screen. You flip it open, it's a video, and it shows you how to use the Narcan if you don't know how to use it.
Mm.
We're putting that in the hot areas of where the overdoses are happening or where the drug use is rampant.
Mhm.
Because we get data from police departments and sheriff's departments. They tell us, hey man, this area is being hit hard right here.
Yeah.
That area is being hit hard right there, because they're tired of picking the bodies up themselves.
Yeah.
Mhm.
But the thing I'm trying to do, and she's trying to do, and everybody else is trying to do, is stop that revolving door.
Yes.
Jail, treatment, psych ward, street, jail, treatment, psych ward,
Yes.
back to the street. It
Yeah.
just goes round and round and round. And we're all sitting here like, can we go into behavioral medicine units, or we go to jail, and we're seeing the same clients, 5, 6 times in the year.
Yes.
And I'm like, I
I
want to pull
thought
my
you
hair
were
off.
at treatment.
Yeah.
Yeah, like I took you to treatment a couple months ago. What are you doing back here? And sometimes we lose touch with them. We don't want to, but we lose touch when they get into treatment. We don't hear from them anymore, and then we see them there, and And it's, to me, like community corrections court referral, I know they're doing all that they can and they have a certain particular job, but how many times do we need to send them to the same treatment facility if that one's not working for them? Or do we need to, just hyper focus on this one place and let's send everybody there because they're accepting them at this point? Well, let's find their pathway to recovery. Let's do an assessment. Peers is wonderful at setting up assessments. That's another thing that we have a hard time finding in Alabama, but assessments to find the level of care so that there can be, maybe it's just intensive outpatient treatment they need, or maybe it's something else, but maybe they need detox. We can, peer can get them into detox. They have that certain level of care and can kind of do step down because it's, you have to grow in your recovery. So if you start at the top and then kind of step your way down, you're not just reintegrated into society with 28 days of sobriety. And that works for some people, but for some, like it takes a while to learn and unlearn and relearn some new behaviors. And
of course,
I'm gonna tell you something. Some of these sober living houses, recovery houses I see, they nicer than my house.
Oh yeah, they are.
I mean, they're in nice
Yes, they
areas.
are.
I mean, they're not over here, wherever the bad part of towns. I mean, they're putting them in great parts of town.
Right.
I mean, they are now with AARR and the ADMH and everybody else, they're trying to reform this situation because there's some recovery houses that have turned out to be just a flop house. But there are good organizations and good houses in this state that are trying to help these people and to teach them how to learn how to clean a bedroom, how to make a bed, how to wash clothes, how to cook, pay the bills,
basic living skills for sure.
BLS, all of that. We've heard that enough, haven't we? But the thing about it, though, is but they're teaching them because we have to be taught, because we might have been taught as a child, but we forgot it.
Right.
Because in active addiction, you walked in a flop house, it was a flop house.
Yeah.
I don't know if you sit on a couch sometimes.
Right.
You might just sit on the floor or a box. Crate.
Right.
But, it's just, and I mean, like I said, I commend the city of Dothan for everything that they've done, especially the police department, the sheriff's department. I mean, the sheriff himself and the chief of police, they are doing their darndest to fight this, but they can only do so much. And what we're trying to tell them is, hey, we're here. Our services are free. Let us help you.
Right.
Let us show you that we can get that person out, because y'all are tired of seeing them every other week. So let us help.
Right.
If it's straight addiction, let us help you.
Yeah.
That's all we're asking. We don't want a dime. Like I discussed with you earlier, if we're taking somebody to Florence, Alabama, we're not asking for gas money.
That's coming out of you guys' pocket.
Correct.
Yeah.
That comes out of state funding for us so that we can transport these people.
Yeah.
And the thing about it, I mean, and we don't do this for the money. We
No.
work in mental health.
I made a lot more money at other jobs than I make now.
Yeah.
I was in the car business for 28 years.
Right.
Yeah.
I made a lot better money.
Yes.
Yeah. This is
But the
definitely
thing
a
about it-
calling for you
Yeah.
guys.
Yes. I mean, because at the end of the day, I mean, I look at my paycheck on every Friday. I'm like, can I get a box of grits this week for lunch?
Right. Yes, for sure. For sure.
But I'm grateful for the OD2A
Right.
grant, because they put this team together. We're in the state prisons, we're in the universities, we're in the community college, we're everywhere, and we're talking to anybody and everybody that'll listen.
Yeah.
I will talk to you till I turn blue in the face, or you fall asleep one, and y'all probably still keep talking while you're sleeping.
It'll be seeping in through the brain.
That's right. That's
Yeah.
right.
But that's how I should do my kids. I
Right.
try to talk to them while they're sleeping, maybe they listen because the other time it's going in and out. But it's just trying to just get them to understand, especially the community, we are not bad people.
Right.
We made bad choices.
Right.
And everybody deserves a chance to right those
Yes,
wrongs.
and
And-
everybody is one choice away sometimes from that lifestyle. Literally one choice away.
And like you said earlier, it affects everybody, rich, poor, young, old. It don't matter who you are. It can.
Yes.
We've all been touched by addiction or overdose in some shape, form, or fashion.
Yes.
So-
Because you've got people that, I mean, you literally see them, they're in a rich neighborhood driving the lawnmower and they got them a glass of whiskey in their hand.
But it's legal.
Yeah. But my issue being with them is that's an alcoholic. You can't cut your yard without a glass of whiskey.
Mm-hmm.
I mean, normal people don't go outside in 110-degree weather with some Jack and Jim.
Yeah, that sounds gross to me, right?
Yeah. I mean, or got a Bud Light, or
Yes.
I'm not trying.
Being out in 110-degree with a bottle of water sounds gross. Actually.
Yes.
I mean, I don't need a cold beer because I'm just going to get thirsty.
Right.
Right.
And I'm going to fall off the lawnmower, and the lawnmower is going to run over me.
Right.
And then I'm chopped up, and now I'm down here at Southeast with a substance use injury.
Right.
Right.
But like she said, you can go in any store, you go in any restaurant, you can buy it anywhere you want to. Well, guess what? You can buy the dope anywhere you want to right now too.
Yes.
That's true.
Yes,
You can go to any
can.
convenience store. I mean, we
Yes.
see you see the flashing lights coming through the city of Dothan. You think you done hit Las Vegas,
Hmm.
Right.
and I'm not being mean.
Yep. No, you're being honest. You're being
Yeah.
honest, and it's a great thing that you guys are doing to bring awareness to, because, like I said, it's a huge problem that a lot of
Yeah.
people, or some people, don't even notice, and bringing awareness to it is definitely very important. So I commend you for what you guys are doing. 100-mile walk. That is that's a
One
long way.
100 miles. My wife has now got got $1 million life insurance policy on me, so she's expecting me to fall out halfway between here and Montgomery. I refuse to. I'm actually going to Love to Run on Friday to get me
There you go.
get my feet measured and get a
Yes.
couple pair of sneakers. I got
Right
about 50
on.
pair of socks.
Nice.
Change socks every 3-4 hours. Now I won't be the only one walking. There'll be other people. If y'all want to be involved, just come walk a half a mile, a mile.
Mhm.
Yeah.
Just and walk in somebody's memory.
Yep.
Yeah.
If you want to donate, like she said earlier, on the Facebook pages, we have the Amazon link wish list.
Mhm.
You know, we're not asking for nothing crazy. You know, the
Right.
frog togs, you know,
Right.
liquid IV, water. If you don't have Amazon, you can drop it off at the Pier Building, 1930 Wise Drive.
Hmm.
Come by there and drop it off. You know, and all this stuff will be accounted for and used on the way. And that if you want to walk, you can have some with us.
Yeah.
I
Yeah.
mean, I know you're about to have a baby on the way, but if you get an hour, just come out and join us for a little bit and just see what
Mhm.
we're about and see what we're talking about, because we're not bad people.
Yeah.
Mhm.
I promise you we're not.
No, I've thoroughly enjoyed you
Yeah.
guys this morning.
Yeah.
And
Thank
hey,
you.
Dylan, we thank you so much for allowing us to come
Yes,
in.
thank
Absolutely.
you.
Congratulations on the new baby
Thank you.
that's
I
coming
appreciate
very
that.
soon.
Thank you.
Very, very
Yes.
soon. Make sure you go back to your home after this
I will.
and tell the wife we apologize for bringing you in
Yes.
this early.
No, you guys are
Yes.
fine. You
But
guys are fine.
but we want to thank you. You've been a very great help. Wiregrass
Yes.
Daily News. That is my news source here in the Wiregrass,
Yeah.
because I know if anything's happening, they're gonna talk about
That's
it.
right.
That's
Yeah, they're on
right,
top. We're
yeah.
on top of it.
Yep.
So if anybody wants to get involved, People Engaged in Recovery Facebook page,
Mhm.
also the 100-mile walk. What was the 100-mile walk?
Enduring Their Legacies.
Enduring Their
Mhm.
Legacies. That's
Mhm.
another Facebook page for the actual walk.
And then
Yeah.
her.
And then you got
rural addiction prevention.
Rural Addiction Prevention. We'll
Mhm.
drop a link to all of those pages down in the description below the video. So if you're
Alright.
looking for any resources or help or just want to be a part,
Yeah.
click on there, and all the information is there for you. John, Lisa, thank you guys so much for coming in.
Thank
Thank you.
you.
Really appreciate it.